Let me introduce Anthony Navarro. He is our new development director and dad to Emmy, and we're really excited that he's taken on working with all of us.
Okay, thanks for having me. Okay, so introductions. I'm Anthony, father, like Suzanne said, to little Emilia in the back there, wife to Chelsea. So if you've read any of the press releases, Chelsea's the one who is writing them and hounding you all for quotes and other things. So thank you, Chelsea, back there for that. So we've been working on this impact report as an organization, several people that are here today, several people that are not here today. And we're really excited to show you an abbreviation of that formal impact report that will come out the new year. I believe January 1st is what we're aiming for. Yeah, January. And in that impact report, again, as Suzanne mentioned, we are going to be showing what SRF has been doing and will continue to be doing in a formal impact report. So a couple disclaimers. I'm going to plug fundraising and sponsorship. So if anybody wants to do a fundraiser, I'm the guy to speak to about that. If you are interested in sponsoring in any way, shape, or form, your company or you know a company or anything like that, come talk to me and I will get you the information you need to do that. As well, for this report, again, this is an abbreviation, so you'll see some slide differences as we move through. I may say we're on slide 15 and you may see 17 in the upper right-hand corner, and that's because it's an abbreviated report. So with that being said, we will go ahead and get started and we will move through. So I'm really excited to share this with you. The mission of SRF is to improve the lives of patients and families suffering from SYNGAP1 related disorders. My daughter, Emmy, is in the upper right there. So this is one of the many reasons I joined SRF, not only to help my daughter, but to help all of the families that are suffering from SYNGAP and its related disorders. So I know that I needed to get involved, and if anybody is interested in getting involved in any way, shape, or form, talk to Zoe, and we can get that going. Everybody here knows, I'm sure, the devastating impact of SYNGAP1 related disorders in patients. This is a really nice slide that just says we have a lot going on with our kids, right? We know this, we live this day in, day out. And so this is just a nice slide that shows that. So accelerating genetic and translational science research. We as a fund are going to continue to do a lot of things to move the needle forward, right? And with that, we have 7 core scientific programs, and you've been seeing these if you were here yesterday or you were paying attention to some of the other conversations that happened today, right? We are doing basic and translational science. We're doing drug repurposing. We are doing missense analysis, research, and therapeutics. We're looking at biomarkers and endpoints. We're looking at research tools and reagents. We are, characterizing SYNGAP1 related disorders. And we're doing the natural history study at multidisciplinary clinics with CHOP, with, Children's Hospital of Colorado, and potentially another site soon. And we're pouring money into each of these to move the needle forward, right? So since SRF has been founded, we've, scientific funding to date is over $6 million. And you can see here kind of in the buckets where that money's going. And this is really important because as we've been talking, throughout this time yesterday and today, we are hoping to bring cures to our kids faster, right? Not just, over time, spending billions and billions of dollars. Although, if you want to give $1 billion, come talk to me. Grants, right? So this is something that's, when we say we're moving science forward, I've got 3 slides on this. This shows you, right, since SRF has been working, where these grants go, where the money's going, what institutions are being funded and what they're studying, right? So we've worked with 30 plus institutions, and we're continuing to bring new institutions on board to continue doing science in a variety of different ways. So I'm going to show you the 3 different slides with the different grants. And then I think the other important part of this, which I'll show you a little bit later, is the papers that are coming out of these grants that we've been funding, right? So basic translational science, facilitate, drug repurposing, right? You can see there, I mean, a lot of different institutions. This is amazing. And then I think the other kind of thing that we're working on is being the largest non-government funder of Syngap One research globally, right? We are providing those funds to these different grants to move science forward. So funding the future, right? We're not just talking about today or yesterday, but also tomorrow and finding additional patients and kids with Syngap, right? So how are we doing that? What has been going on? What's been done? If we look at drug repurposing, Lindsay did a great job explaining this, way better than I ever could. So definitely go back and watch that. But just know that, you know, as an organization, we are looking at multiple drugs. We're working with organizations and institutions to try and figure out ways to bring solutions to our kids faster. As I mentioned, the papers, right? So this is a really nice slide. I think it's an impactful slide that shows, you know, when SRF came on the scene, if you look on the far right there, it's a sharp upward, you know, curve trajectory of we have a direct impact on the number of papers that are being produced and published on Syngap research, on Syngap 1 related disorders. And because of our presence, right, we are, I mean, this year was a record-breaking year for publications. We have 50 that were published in 2024, which is more than any other year. And I mean, 14 publications were supported directly by SRF's funding efforts. And these papers are, again, you'll keep hearing me say this, moving that needle forward for our kids. So then how else as an organization are we collaborating? Are we finding a cure? Are we working with other institutions, right? So SRF is collaborating with you know, academic institutions, industry institutions to develop medicine for our kids. We have a really strong, robust pipeline. We've been hearing about this. You've been seeing this. You've actually had some of those groups here yesterday talking about the specifics, but then also today going through some of these. And we've got small molecule research going on, ASO research, AAV research, you know, cell-based. And we want to be on the scene in every way that we can be to work on developing medicine for SRD. So educating, supporting, and activating the Syngap One patient community. How are we doing that? How have we been doing that? What are we going to continue to be doing? You know, connecting with Syngap patients. Why does it matter and how do we do it? Right? I think if we continue to find Syngap patients, you know, and work on early diagnosis, intervention, building a support network, advancing research and data collection, and then increasing advocacy and awareness, it's going to make the community that much stronger. It's going to help bring awareness. It's going to help bring more money in to, again, fund more grants and just, again, hopefully work on finding a cure that much faster or a solution for our kids. I think a great example of this and something I'll never forget is with our daughter specifically. I found out about her diagnosis with Syngap 1 related disorders on her birthday. And that night, Mike called me and had a conversation with me about what that means, what I need to be doing, how should I get involved if I'm interested in getting involved. Um, and, I took some time to process that, but I think that shows the strength of our community, that people are willing to reach out, people will reach out, and people will continue to, be there. And I'm going to show some slides on that in a little bit, but that's a perfect example of, building that support network, right? If you are not aware, we are on social media. We are on all the social medias. If you're not aware, I would say join the social or all of the socials that you engage with. Follow us, share us, repost the things that we're posting. And not only helps with the awareness, but it also brings in donations. It helps just with partnerships and all sorts of campaigns that we're doing and other things, with international collaborations. I mean, connect with us on social media. That's what I'm trying to drive forward here. I think also what's important to note here is we have an ICD-10 code. If you don't know what that is, make sure with your kids when you talk to your doctors, right, that it's in their chart. There's a reason for it. It actually means that you can get insurance coverage for Syngap. Don't quote me on that. I'm not an insurance expert or doctor, but it's hugely important for us to have that, right? I love this slide as well. I think something that's very important for our community is that we know where our people are. We know how many people are in our community. And for future drug trials, other things, this is going to be very important when somebody reaches out and says, hey, we're interested in doing this trial. Do you know where your folks are, and can you quickly give us a number of how many people you think could get in this trial, right? We could literally go, okay, here's a list. Who do you want us to call? And we can do it. We can give that information. And so this also helps, though, what we're going to show here in a second is that all translates into the webinars, the newsletters, the movies that have been done, the blogs that have been posted, the volunteers. We have over 100 volunteers that are working for SRF. The patients that have been profiled, the followers that we have on social media, all of that, right, brings into this aspect for SRF, right? We have the support, we have the community, and we're activating that community. We're utilizing that community to do the things that we need to do for our kids, for our families. So flipping to public policy, this is just as important as just bringing awareness, but we need to be in the Capitol. We need to be, in each state advocating for our children. It's really disheartening. Just another example, when we go to a doctor's office and we're the experts, right? We don't have the clinical knowledge or anything like that. And we're having to share what should be done for our kids, what shouldn't be done. If they try to give us a medication that we know is not going to work, and then you have to fight with your doctor, we shouldn't have to be doing that, right? So I think what also is important to share is that we have a diversity, equity, and inclusion board. This board does meet to make sure that we're advocating for our families and our kids across the board. In every way, regardless of their background, regardless, to make sure that there's equitable access to resources, opportunities, and support, right? So if you have any questions, feel free to reach out to any of these folks listed. This one specifically, public policy, right? Making sure that we continue to advocate state-specific resources, understanding, home and community-based waivers, special education forms, contacts, what do we need to do? Direct patient advocacy, I think if you were here yesterday and some of the conversations today, even this continual need to have, the FDA is wanting to hear from the patient population and not just the drug companies, right? So making sure that our patients their voices are being heard and that their needs are being met. We also partner with different organizations to make sure that we are driving, making sure that Syngap SRF is known, is aware, and we're continuing to move that needle forward. We have a really robust ambassador and advocates program. We ideally are shooting for an ambassador in every single state. And this is somebody that you can reach out to and ask questions, get connected, just know somebody. Another personal example is, right, we had our daughter diagnosed. We reached out to Emily Barnes in Massachusetts and said, hey, we know you have a Syngapian. We're new to this community. Can we meet? And we ended up meeting at a pool and had a pool party and just were able to talk about our kids and what it means to be a part of this community. And I think, just having that opportunity and having that access is key, right? But then also not the state ambassadors, but also the advocates as well of, hey, what doctors are you going to? What's worked well? What hasn't worked well? Do you know anything about this state-specific waiver? Or do you know anything about, ABA in your state? Are you on a 5-year wait list, or are you not on a 5-year wait list? Anything like that, right? Breaking barriers, making sure that people can be connected in the community and understand the resources that we do have to give to our community. This one, I can't really take credit for Peter, me taking over for that kind of role this past year, right? We are raising funds and building community through our events. We've got Scramble. We raised over 27,000. The Syngap Research Fund Gala, our UFD charity stream, Sprint for Syngap, which everybody I'm sure has heard about. If not, it's coming up. The $1 Million Bike Ride. And then a plug, I will say right now, we have our ongoing Coast to Coast Clinics Syngap Research Fund Challenge going on. You can join a team, East, West Coast, raise funds, and we're trying to, potentially open another multidisciplinary site, right, with those funds. The other plug I'll put in here as well is that if you're a federal employee, retiree, you're in the military, you have any way, shape, or form, you're part of the federal program, you can give funds, you can give to SRF through the Combined Federal Campaign by using our CFC number. If you have questions about that, reach out. I can help you. If you know somebody who's interested, again, reach out to me. I can help you with getting that connection. But this money, again, goes to funding grants, opening sites, hosting webinars, making sure that our kids have the resources, the connections, and then trying to move the needle forward. We have a scientific advisory board. We've got a clinical advisory board. They're doing great things. It's not just us trying to come up with things, whatnot. We talk to the experts. Our board of trustees and then the SRF directors. It's run by families for families. SRF is great. And then I do want to just take a moment to have a moment of silence for somebody in our community that did recently pass away. So if we could just take a moment of silence and pause and reflect. So in loving memory, Annie Jane Peck. Syngap One Warriors, we do everything for them. So, we want to hear the stories of our kids. If you have not done a warrior story, please reach out. We can get one of those for you and help you with that. But this is the reason why we're doing everything. And with that, I'll leave you. Breakthroughs begin with you, right? Your impact will move us closer to a cure. And this is something you'll hear a lot. Time, money, data. Thank you.